Cardiac surgeon warns, this sleeping position raises stroke risk overnight. Did you know that the way you choose to sleep tonight could be silently accelerating your aging process, subtly stealing precious years from your heart, your brain, and even your cherished independence? It might sound like an astonishing claim, yet emerging research from the esteemed National Institute on Aging suggests that specific sleeping positions can significantly amplify your vulnerability to stroke, memory loss, and chronic pain, potentially by over 60%. What's particularly concerning is the aspect that often goes unaddressed. A vast majority of seniors unknowingly adopt these detrimental positions night after night. For countless older adults, the natural challenges of aging have made sleep a more arduous experience, characterized by restless tossing, frustrating turning, and the demoralizing sensation of waking up exhausted or achy. But what if the root of the problem isn't the duration of your sleep, but rather the manner in which you are sleeping? Scientists are now asserting that your chosen sleep position possesses the dual capacity to either actively heal your body or to systematically break it down over time. It has the potential to offer solace to your joints, provide crucial protection to your spine, and enhance vital blood flow throughout your body. Conversely, it can precipitate the exact opposite outcomes. This evening, we are embarking on an in-depth exploration of this critical topic. We will be uncovering the 4 most perilous sleeping positions that individuals over the age of 60 should assiduously avoid, and conversely, the 4 more beneficial alternatives that can effectively restore your energy reserves, sharpen your memory, and even help you greet each new day. Feeling years younger, we urge you to remain engaged because the revelations you are about to encounter have the profound potential to fundamentally alter your perception and practice of sleep forever. Before we delve into the specifics, if you haven't yet subscribed to our channel, we highly recommend you take a moment to click that subscribe button and activate the notification bell. This ensures you will never miss another invaluable health tip thoughtfully curated just for you. If you find this presentation enlightening, please express your appreciation by typing the number 1 in the comments section below. If, however, you believe there are areas where we can improve, please type 0 so we can gain valuable insights on how to create even better content for your benefit. Part 1. The 4 worst sleeping positions for seniors. 1. Sleeping on your stomach. The face-down position. It might initially offer a sense of comfort, lying face down with your arms tucked beneath your pillow, drifting off as if the worries of the world cannot reach you. Indeed, many older adults, much like Mr. Harold, a 72-year-old retired carpenter hailing from Ohio, attest that this is the only position in which they can find sleep. He once confided in his physician, stating, "It feels like my back relaxes." However, what Mr. Harold failed to recognize was that this perceived comfort was insidiously undermining the health of his neck, his spine, and even compromising his ability to breathe effectively night after night. While sleeping on your stomach may seem innocuous, for seniors, it constitutes a silent but significant strain on some of the most delicate and vital parts of the body. When you are compelled to turn your head to one side for extended periods, your neck muscles undergo unnatural twisting. This contortion can severely impede blood flow to the brain and compress delicate nerves that traverse along the spine. Over time, this chronic compression invariably leads to persistent stiffness, persistent headaches, episodes of dizziness, and that all too familiar sensation of tingling in your hands or arms upon waking. According to the American Chiropractic Association, this particular sleeping posture demonstrably increases the risk of cervical misalignment. This condition, in turn, can precipitate long-term issues with balance and coordination, posing a particularly grave danger for older adults who are already more susceptible to falls. The detrimental effects, however, do not cease there. The act of pressing your chest against the mattress actively restricts the capacity of your lungs to expand fully. Your diaphragm, a crucial muscle for respiration, is unable to move with the necessary freedom, thereby forcing shallow and inefficient breathing patterns throughout the night. For individuals over the age of 60, this translates into a diminished supply of oxygen reaching both the heart and the brain. This reduced oxygenation can exacerbate feelings of fatigue, contribute to cognitive fogginess, and even lead to an elevation in blood pressure. Compounding these issues, sleeping face down imposes undue and unnatural pressure on the lower back, a concern of paramount importance for those who already contend with spinal arthritis or the debilitating effects of herniated discs. Dr. Emily Roth, a specialist in geriatric sleep, emphatically labels this position as the most aging-inducing posture for the spine. She elaborates that, over an extended period, it accelerates the natural wear and tear on the vertebrae, akin to repeatedly bending a fragile branch of a tree until it inevitably cracks and breaks. Therefore, while the comfort of stomach sleeping might feel inviting, it is quietly diminishing your overall well-being and comfort in the long run, one restless night at a time. If lying on your stomach is recognized as so detrimental, a pertinent question arises. What about the familiar act of curling up on your side? It often feels instinctive, even deeply comforting, yet it harbors its own unique set of dangers. We shall uncover these next. If you are still actively engaged with this information and find these insights to be beneficial, please signify your agreement by commenting with the number 1 below, letting us know that you are with us on this journey. Now, let us proceed to point number 2. 2. Sleeping in a fetal curl, knees to chest. It is a position that evokes a sense of familiarity, almost a childlike regression. Many older adults find themselves curling into a tight ball during the night, drawing their knees up towards their chest, arms tucked in close, as if seeking to shield themselves from the external world. For Mrs. Eleanor, a 68-year-old grandmother from Michigan, this had been a lifelong habit. She once shared, "It feels safe, like I'm cradling myself to sleep." However, after years of enduring morning shortness of breath, persistent back stiffness, and a progressively debilitating fatigue, her physician unveiled a stark and startling truth. Her seemingly cozy sleeping position was, in fact, subtly suffocating her body on a nightly basis. While the tight fetal curl might offer a sense of emotional comfort, it simultaneously imposes significant physical restrictions, particularly for seniors. According to the National Sleep Foundation, when your knees are drawn too closely to your chest, your diaphragm becomes compressed. This compression directly impedes your lungs' ability to expand, thereby limiting crucial oxygen intake. This forces your body into a pattern of shallow, rapid breathing. For older adults, whose lungs are already naturally less elastic due to the aging process, this subtle yet persistent reduction in oxygen can manifest as chronic fatigue, persistent morning headaches, and even place undue strain on the heart. The perils of this position, however, extend beyond respiratory compromise. Maintaining a tightly curled spine for hours on end forces it into an unnatural, C-shaped curvature. This prolonged contortion leads to the shortening of the muscles and ligaments that are essential for maintaining good posture. Over an extended period, this can exacerbate existing spinal curvature, making one appear more stooped, less stable, and significantly more vulnerable to falls. Dr. Leonard Hayes, a renowned spine specialist with over 3 decades of clinical experience, issues a stern warning. For seniors, sleeping in an overly curled position is tantamount to spending the entire night teaching their bodies to shrink and lose their upright form. Mrs. Eleanor's experience serves as a poignant cautionary tale for many. What began as a simple comfort gradually devolved into a deeply ingrained habit that gradually deprived her of vital energy and compromised her posture. The fetal curl may offer an illusion of safety, but for aging bodies, it represents an insidious trap, one that systematically diminishes strength, impedes respiration, and undermines balance night after night. If curling into such a tight position is recognized as being so detrimental, a natural follow-up question arises. What about lying completely flat, akin to the disciplined posture of a soldier? Many medical professionals once lauded this position for its purported benefits to spinal health, but it may surprise you to learn that it too carries hidden risks that regrettably few seniors comprehend until the consequences become undeniable. 3. Flat on your back with no support, the soldier position. For decades, the prevailing medical advice often posited that lying flat on one's back was the most salutary way to sleep. The rationale was predicated on the idea of a straight spine, even weight distribution, and perfect anatomical alignment. However, for older adults, the reality of this sleeping position is considerably more complex and, regrettably, far more perilous. What was once perceived as a posture of discipline and order can insidiously transform into a nightly battleground for your heart, your lungs, and even your brain. Consider the case of Mr. Robert, a 74-year-old veteran from Florida, a man of considerable pride. He had maintained the soldier sleeping posture his entire life, lying perfectly flat on his back with his arms precisely at his sides, his head resting on a minimal pillow. Yet, as the years progressed, his wife began to observe unsettling changes. She noted prolonged pauses in his breathing during the night, accompanied by loud gasps for air, and mornings where he would awaken feeling utterly exhausted and disoriented. When Mr. Robert finally sought consultation with a sleep specialist, the diagnosis he received was profoundly shocking: severe obstructive sleep apnea. It was revealed that his own preferred sleeping position was actively constricting his airway to the extent that it was ceasing breathing up to 30 times every hour. When seniors lie flat on their backs without adequate support for their head and neck, the force of gravity can cause the tongue and surrounding soft tissues to relax and fall backward. This obstruction significantly narrows the airway, leading to disruptive snoring, episodes of choking, and interrupted breathing patterns, often without the individual's conscious awareness. According to the American Academy of Sleep Medicine, untreated sleep apnea in adults over the age of 60 carries a substantially elevated risk of stroke, heart attack, and memory loss, with some studies indicating an increase of over 60%. It also contributes to heightened blood pressure during the night, placing a silent but significant strain on the heart as it struggles valiantly to secure adequate oxygen. However, the potential dangers associated with this position do not end with respiratory compromise. Lying flat also serves to exacerbate the symptoms of acid reflux, a prevalent condition that affects nearly half of all adults over the age of 65. When your head is positioned at the same level as your stomach, gravity can no longer effectively prevent digestive acid from migrating upwards. This acid can then creep into the esophagus, causing a burning sensation and disrupting sleep. Over time, this persistent irritation can even inflict damage upon the vocal cords and lungs, a condition colloquially referred to by physicians as silent reflux. For Mr. Robert, the realization of the damage came perhaps too late. Years of suboptimal sleep had already exacted a significant toll, manifesting as persistent fatigue, increasing forgetfulness, and a stubborn case of high blood pressure that resisted all efforts at reduction. His story serves as a stark reminder that sometimes stillness can indeed conceal profound danger. If sleeping flat can so insidiously harm your heart and brain, what can be said about the practice of sleeping in a semi-upright position, as one might in a recliner chair, a position that so many seniors swear by? You might be astounded to learn how this seemingly comfortable arrangement could be gradually weakening your body from the inside out. If you are still actively engaged with this information and find these insights to be valuable, please comment with the number 1 below to signify your presence and interest. Let us continue our discussion with point number 4. 4. Sleeping in a recliner chair. Every night, for many seniors, the descent into sleeping in a recliner chair begins innocently enough. The recliner often represents a welcome comfort, a soft, yielding sanctuary for much-needed rest. It provides solace for aching joints, a convenient spot for enjoying television, or a place for a brief restorative nap. When the simple act of lying flat in a conventional bed becomes increasingly uncomfortable due to persistent back pain, the stiffness of arthritis, or the discomfort of acid reflux, that same familiar recliner gradually transitions from a temporary respite to a permanent sleeping arrangement. However, as comforting as it may feel, the nightly habit of sleeping in a recliner chair constitutes one of the most potentially detrimental practices that older adults can adopt. Consider the experience of Mrs. Dorothy, a 79-year-old widow from Arizona. After enduring years of chronic hip pain, she discovered that she could finally achieve uninterrupted sleep in her recliner. Yet, over time, she began to notice alarming changes. Her legs became progressively swollen, her back grew increasingly stiff, and her overall energy levels seemed to be rapidly fading. What she was unaware of at the time was that her beloved chair was systematically undermining her health. According to Dr. Michael Turner, a specialist in geriatric rehabilitation, sleeping in a recliner chair maintains the body in a semi-sitting posture. This position significantly restricts the natural flow of blood to the legs. The consequent effects include fluid retention, leading to swollen ankles, and, in more severe instances, the development of deep vein thrombosis, potentially life-threatening blood clots that can migrate to the lungs. Furthermore, the semi-upright angle inherent in recliner sleeping prevents the spine from achieving complete relaxation. This perpetual tension can lead to chronic lower back discomfort and accelerate the weakening of the muscles in the hips and abdomen over months or even years. Such weakening can directly contribute to balance problems and a significantly increased risk of falls. Perhaps most concerningly, because the reclined position limits the progression into deeper sleep cycles, the body is unable to truly engage in its essential restorative processes. While one might close their eyes for 8 hours, the brain and muscles remain in a state of light rest, never reaching the crucial stages of healing and memory consolidation that the body desperately requires. After the age of 60, Mrs. Dorothy eventually transitioned back to a conventional bed, following a stark warning from her physician that prolonged recliner sleeping could, in fact, shorten her life expectancy. She poignantly reflected, "I thought I was resting, but I was slowly shutting down." If the recliner position is demonstrably unsafe, a critical question emerges. Where then is the optimal place for rest? The answer lies not solely in the physical location of your bed, but more importantly, in the precise way you position your body. And in part 2 of our discussion, we will embark on an exploration of the 4 sleep positions that possess the remarkable ability to truly heal, restore, and protect your body from the inside out. Part 2. The 4 better sleeping positions for seniors. 1. The supported side. Sleep with pillow between knees. This is one of the most straightforward adjustments you can implement, yet for seniors, it holds the transformative potential to revolutionize how you rest and how you awaken each morning. Sleeping on your side with a soft pillow gently placed between your knees might appear unremarkable, but for your spine, your joints, and your heart, it represents one of the most profoundly healing positions you can consciously choose. Consider the experience of Mr. Allen, a 71-year-old retired firefighter from North Carolina. For years, he would awaken every morning to a persistent, dull ache in his lower back and hips. While pain medication offered some temporary relief, the stiffness invariably returned. During a routine checkup, his physical therapist posed a simple yet pivotal question: "How do you sleep?" Mr. Allen responded that he slept on his side with his knees pressed together. That very night, following her recommendation, he tried slipping a small pillow between his knees and adjusted his head to ensure it aligned harmoniously with his spine. Within a mere 2 weeks, his pain had diminished by nearly half. He described the sensation, saying, "It's like my body finally exhaled." There is indeed substantial scientific evidence supporting this seemingly simple practice. According to research conducted at the Cleveland Clinic, side sleeping, particularly on the left side, actively promotes improved blood flow to the heart and significantly reduces the incidence of acid reflux by ensuring that the stomach remains below the esophagus. The strategic placement of a pillow between the knees serves to maintain pelvic balance, thereby alleviating undue pressure on the lower spine and hips, two of the most common areas of discomfort for adults over the age of 60. This simple act also minimizes the twisting motions that often contribute to morning stiffness and joint inflammation. Medical professionals have affectionately termed this position the alignment saver because it naturally supports the body's inherent curves without inducing strain. Furthermore, it is considered one of the safest positions for individuals who suffer from sleep apnea, as it effectively helps to keep the airways open throughout the entire night. Mr. Allen's story is far from unique. Thousands of seniors have discovered that this minor postural adjustment can make the profound difference between waking up feeling drained and depleted or waking up feeling invigorated and strong. However, if you are among the many who find it difficult to sustain side sleeping for extended periods, please do not be discouraged. There exists another beneficial position, one that employs a gentle incline to protect your back, alleviate reflux, and even assist you in breathing more easily throughout the night. Let us discuss this next. 2. The elevated back sleeper, head and knees, slightly raised. For a considerable number of seniors, the act of sleeping completely flat on their back can feel excessively rigid and inherently uncomfortable. However, with a subtle yet impactful adjustment, a gentle elevation of both the head and the knees, that very same position can be transformed into one of the most therapeutic methods for resting and facilitating bodily healing overnight. This specific configuration is recognized by medical professionals as the elevated back sleeper position. For older adults, adopting this posture can be the crucial difference between enduring restless nights and experiencing truly restorative sleep. Consider the experience of Mrs. Linda, a 73-year-old retired teacher from California. She had grappled for years with persistent heartburn and nightly shortness of breath, frequently awakening with a cough and a burning sensation in her throat, indicative of acid reflux. Her cardiologist, Dr. Raymond Cho, proposed a simple yet effective solution. Elevate her upper body by approximately 30 degrees and place a small pillow beneath her knees to promote relaxation of the lower back. The results, she reported, were nothing short of life-changing. Within a matter of days, Mrs. Linda noticed a marked improvement in her ability to breathe easily and sleep soundly throughout the night, free from gasping or painful episodes. The scientific principles underlying this position explain its remarkable efficacy. Elevating the head and chest allows gravity to perform its essential function, effectively preventing stomach acid from migrating upwards and helping to keep the airways from collapsing during sleep. According to the American Academy of Sleep Medicine, seniors who sleep with their upper bodies slightly elevated experience a significantly reduced number of snoring incidents and sleep apnea episodes. This reduction in breathing disturbances consequently minimizes disruptive drops in oxygen levels during the night, which can place undue strain on the heart and potentially damage brain cells over time. Concurrently, the elevation of the knees gently alleviates pressure on the lumbar spine, allowing the surrounding muscles to achieve complete relaxation. Dr. Cho frequently advises his older patients, stating, "It's not about sleeping longer, it's about sleeping smarter. By providing your body with the correct angles, you are giving your heart and lungs the necessary room to function optimally, even while you dream." However, what if you are seeking a sleeping position that not only supports your breathing, but also actively rejuvenates your joints, shoulders, and even contributes to the health of your skin? The subsequent position, often overlooked yet remarkably restorative, might just be the missing component in your sleep regimen. 3. The starfish position, lying on your back with arms out there, exists a certain profound sense of peace in lying flat on your back, with your arms gently spread wide to your sides, palms open, as if your body is finally releasing the burdens of the day. This posture is widely recognized as the starfish position. While it may appear deceptively simple, it stands as one of the most restorative ways for seniors to achieve rest, provided it is executed correctly. Unlike the rigid, flat soldier position, the starfish position grants your body a sense of liberation. It allows your shoulders to open freely, your chest to expand fully, and your joints to release the accumulated tension they have held throughout the day. Consider the experience of Miss Linda, a 69-year-old retired nurse from Minnesota. After dedicating decades to her profession, she consistently suffered from aching shoulders and often awoke with neck stiffness that would linger well into the afternoon. Her chiropractor, Dr. Raymond Cole, recommended an unexpected approach. Try sleeping like a starfish. This involved resting with her arms relaxed, palms facing upwards, and her head comfortably supported by a contoured pillow. Miss Linda initially harbored some skepticism, but within a week she reported a noticeable improvement. Her neck pain began to subside, her shoulders felt significantly looser, and she exclaimed, "For the first time in years, I woke up without feeling my age." The scientific explanation behind this remarkable effect is compelling. When your arms are extended and your shoulders are not compressed beneath your body, blood flow to the upper spine and the nerves that support the neck and hands is significantly enhanced. According to the sleep division at Harvard Medical School, this posture has been shown to effectively reduce the incidence of tension headaches and play a crucial role in preventing nerve impingement, which is a leading cause of numbness and tingling sensations experienced by older adults. The starfish position also actively promotes calm and measured breathing. Because your chest cavity remains unobstructed, oxygen can move freely throughout your respiratory system. This facilitates a reduction in nighttime blood pressure and helps to soothe the heart. Dr. Cole aptly describes this position as nature's reset button for the upper body. Nevertheless, it is important to acknowledge that not all back sleepers find this position comfortable for extended periods. Some individuals may experience discomfort in their lower back, or they may simply crave a gentler form of support. For such seniors, there exists one final, highly recommended position, one that achieves the ultimate balance between comfort, safety, and restorative healing. It is known as the 45-degree side recline, and it might very well represent the healthiest way to sleep after the age of 60. 4. The 45-degree side recline, the true senior suite. Spot. Imagine yourself lying in a position that is halfway between sitting upright and lying completely flat. Your upper body is gently supported, your spine is in a state of relaxed alignment, and your breathing feels effortless. This is the essence of the 45-degree side recline, a posture that many geriatric specialists now refer to as the ideal sweet spot for senior sleep. It ingeniously combines the most beneficial aspects of side sleeping with the significant health advantages conferred by elevation. And for individuals over the age of 60, this particular position holds the potential to be truly life-altering. Consider the experience of Mr. Walter, a 78-year-old former truck driver from North Carolina. After enduring decades of chronic back pain, persistent acid reflux, and nightly episodes of shortness of breath, he had explored every conceivable remedy. He had invested in new mattresses, tried various medications, and even resorted to sleeping in an upright position in a recliner. However, nothing had provided lasting relief. It was then that his physical therapist, Dr. Renee Collins, suggested a subtle yet profound adjustment. Mr. Walter positioned himself at a precise 45-degree angle on his left side, utilizing a firm wedge to support his back, a small pillow nestled between his knees for comfort and alignment, and another pillow strategically placed beneath his head to maintain a neutral neck position. The very first night, he distinctly felt the difference. There were no gasping episodes, no lingering heartburn, and no pain in his hips. Within a week, his advanced sleep tracker indicated a significant increase in the duration and depth of his sleep cycles. For the first time in many years, he awoke feeling mentally clear and completely free from pain. Scientific evidence robustly supports Mr. Walter's lived experience. According to research published in the Journal of Geriatric Sleep Studies, this specific posture has been shown to reduce acid reflux episodes by an impressive 70%, effectively keep airways open to prevent snoring and sleep apnea, and provide crucial support for spinal alignment, a vital consideration for individuals managing conditions like arthritis or osteoporosis. Furthermore, it enhances lymphatic drainage, thereby enabling the body to more efficiently eliminate toxins during the sleep cycle, a process directly and positively correlated with improved memory and overall brain health. Dr. Collins frequently reminds her patients, sleep is not merely about rest, it is about recovery, and your body heals most effectively when it is properly supported, not when it is subjected to strain. The 45-degree side recline may appear simple in its execution, but for seniors, it represents a nightly act of profound self-preservation, actively protecting the heart, soothes the spine, and crucially, contributes to the extension of independence. However, before we conclude our discussion, there is an even more powerful overarching concept to grasp. Understanding how all these beneficial positions, when adopted collectively, can transform not only the quality of your sleep, but also the very fabric of your daily life. Let us bring all these insights together in a final reflection, where even the smallest adjustments made tonight can pave the way for a stronger, sharper, and more vibrant tomorrow. Final reflection: sleep as renewal. Sleep is not merely a period of rest, it is a profound process of renewal. As we journey through life and embrace our later years, each night of sleep evolves into something far more significant than a mere pause in our activities. It transforms into a vital form of healing and rejuvenation. The very manner in which you choose to sleep fundamentally dictates how you will greet and experience life itself each new day. For seniors, adopting the correct sleeping position transcends mere comfort. It becomes a crucial strategy for safeguarding the health of the heart, nourishing the brain, and preserving independence for many years to come. The underlying truth is both simple and remarkably powerful. Your body is actively listening to you while you sleep. When you adopt positions that are misaligned or detrimental, your body silently begins to accumulate pain, stiffness, and pervasive fatigue. Conversely, when you sleep in a state of proper alignment, when your body is adequately supported, gently elevated, and harmoniously balanced, it initiates a natural process of self-repair. Muscles begin to relax, joints release their accumulated tension, your heart beats with greater ease, and your mind awakens with enhanced clarity and sharpness. Medical professionals universally concur that even the smallest, most seemingly insignificant changes, such as placing a pillow strategically beneath your knees, introducing a gentle incline to your sleeping posture, or making a conscious shift to your left side, can translate into fewer aches and pains, deeper and more restorative sleep, and ultimately, a longer, more vibrant, and fulfilling life. Therefore, tonight, do not simply go to bed. Consciously create your personal sanctuary for healing. Allow your body to discover its natural rhythm of repair and rejuvenation, because when you provide your body with precisely the right kind of rest it needs, it bestows upon you something truly invaluable in return: enhanced strength, unwavering clarity, and the precious gift of another beautiful morning to live your life to its fullest potential. Sleep well, live well, and steadfastly remember that your most rewarding and fulfilling years can still commence with the gentle promise of tomorrow's sunrise. These profound lessons are intended to inspire you to live your life with unparalleled authenticity and completeness. Now, we sincerely desire to hear from you. Please take a moment to reflect on what you have learned and share one specific insight or action that you plan to implement in your own life. Let us collectively support one another on this shared journey toward embracing these vital truths. If you found this video to be informative and enjoyable, we kindly ask you to leave a comment with the number 1. If, however, you feel there are aspects that could be improved, please feel free to comment with 0. Your valuable feedback is immensely appreciated and guides our efforts to create even better content. We also encourage you to like, share, and subscribe to our YouTube channel to ensure you receive more content of this nature. Thank you for dedicating your time to watch, and here is to embracing the freedom of living life entirely on your own terms.